Hello everyone and a very warm welcome. Today, we're going to tackle a super important topic, something you'll see in your exams and in your clinics for the rest of your lives, histamine and antihistamines. Cello, let's begin.
So here's our game plan. We'll start with histamine itself, the main culprit. Then we'll unpack its classic triple response. After that, we'll meet the drugs that fight it, compare the old versus the new, and figure out which one to use when. And finally, we'll wrap it all up with a real-world clinical case.
All right, let's dive right into Section 1, histamine, the body's alarm. You know, we've all had a sudden sneeze or a random itchy rash, but have you ever stopped to think about what's actually happening inside our body to cause all that drama? What's the pharmacology behind it?
Well, it all kicks off with one tiny little molecule that basically decides to throw a massive and very messy party inside your body. That molecule, of course, is histamine. Its release is what starts all our problems. Okay, now look closely at this image. It tells the whole story. This big purple guy here is a mast cell. And sitting on its surface, you see these little Y-shaped things? Those are IgE antibodies. Now, when an allergen comes along, like pollen or dust, and connects two of these antibodies, it's like flicking a switch.
And that switch triggers a beautiful little cascade. First, the allergen binds. That sends a signal for calcium to just rush into the cell. This flood of calcium is the critical message for all these little blue granules, which are jam-packed with histamine, to move to the cell surface, fuse with the membrane, and boom, they release all that histamine into your tissues.
So, now we're in Section 2. Histamine is out and about. What does it actually do? Well, let's look at its signature move, the triple response. Now listen up, this is a classic, a huge favorite for examiners, so you really want to know this one.
The very first thing you'll see if you inject a little histamine into the skin is a red spot. Why? It's simple, really. It's just the intense widening or dilatation of the tiny capillaries right at that spot. More blood rushes in and the area turns red. And then pretty quickly, that area starts to swell up and rise. This is the wheel. What's happening is those dilated capillaries are now getting leaky, and plasma fluid starts escaping into the tissue around it. That's what creates that classic raised bump.
And finally, you get the flare. That's the redness that spreads outwards from the original spot. This is caused by the widening of the nearby arterioles, and it's triggered by a local nerve signal called an axon reflex. So just remember the sequence: spot, wheel, flare. Simple funda, Hannah?
Okay, Section 3. So if histamine is our villain, causing all this redness, swelling, and itching, how do we stop it? Well, it's time to meet the heroes of our story, the antihistamines. Now this is a really crucial point. These drugs, which we call H1 antagonists, work by blocking the H1 receptor. Think of it like this: the receptor is a lock, and histamine is the key. These drugs don't stop histamine from being released, they just go and sit in the lock so the key can't get in. Some are even cleverer. They're called inverse agonists. They don't just block the lock, they actually jam it shut, reducing its activity even when there's no histamine around.
Moving on to Section 4, first versus second generation. Now, you need to know that not all antihistamines are created equal. This is a very, very important distinction, not just for your exams, but for your day-to-day clinical practice. We basically divide them into two big groups: the old guard, or first generation, and the new kids on the block, the second generation. I'm sure you've experienced this, right? You take an allergy pill and suddenly you feel like you need a 3-hour nap. Well, the reason for that sleepiness is the fundamental difference between these two generations. And the answer lies in one simple concept: the blood-brain barrier.
And this table just lays it all out beautifully. The first-generation drugs, well, they can easily cross that protective blood-brain barrier. And once they're in the brain, they block H1 receptors there, which is what causes that heavy sedation. They also have these other side effects called anticholinergic effects, which give you things like a dry mouth. But the second-generation drugs, they're designed to stay out of the brain, so they treat the allergy without knocking you out.
So that brings us to Section 5, choosing your weapon. Knowing this key difference, how do we decide which drug to actually give our patient? It really is all about choosing the right tool for the right job.
And here's where it gets interesting. Sometimes, the side effects of the first-generation drugs can actually be useful. That sedative property, perfect for someone who can't sleep. That anticholinergic action, it helps dry up a runny nose when you have a cold. We also use them for motion sickness and really bad itching. In these cases, the side effect becomes the main effect we want. But for most of your common allergies, like hay fever or hives, situations where your patient has to go to work, or drive a car, or study for your exam, the second-generation drugs are the obvious, clear choice. They give you all the allergy relief without messing up your day.
Okay, last section, Section 6. It's time to put all this theory into practice with a quick clinical case. This is exactly how you'll be tested in your vivas and how you'll have to think in your clinics every single day.
So, here's your patient. A young man, classic symptoms of allergic rhinitis. But look closely at his history. What's his job? He's a taxi driver. That is the single most important piece of information in this entire case.
So, what are you going to prescribe him? Go on, take a moment and think about it. First generation or second generation? The choice you make here has real consequences, not just for him, but for everyone on the road.
If you said second generation, you are absolutely correct. The right and the only safe choice is a second-generation drug. It will take care of his runny nose and sneezing without making him drowsy. Giving him a first-generation drug would be dangerous, plain and simple. Remember, patient safety always comes first.
We've spent this whole session talking about histamine like it's the bad guy. And in allergies, it is. But we have to remember, it also has crucial jobs in the body, like helping with gastric acid secretion and keeping us awake and alert. So it's not all bad. It's a fascinating molecule, really, with a dual personality. Something for you to think about. Thank you so much for joining me for this explainer.